Hello, Colin Hung here in Nashville, Tennessee for Healthcare IT Today. I am at the NCQA Innovation Summit. The NCQA team invited us down to cover their event. The organization was kind enough to give us a free media registration, but we have paid for everything else. This video is being paid for by NCQA. Now, given how closely this organization works with the government, I wanted to find out what policy changes might be on the way regarding value-based care, ACOs, TEFCA, and of course, interoperability. The organization was kind enough to arrange a meeting with Eric Musser, the Vice President of Federal Affairs at NCQA. I'm excited to sit down with him. Let's get to it. Eric, welcome to the program.
Great, thanks for having me.
I'm excited you're here, and I'm excited to be on stage with you.
Yeah, it's pretty cool. Big stage, big room.
Exactly.
Yeah.
Big stage for a big person.
That's a very nice compliment. Unnecessary, but very nice.
Eric, welcome to the program. And for the benefit of our audience, can you just give us a little bit of your role here at NCQA
Sure.
and a little bit about NCQA itself?
Yeah. Well, NCQA has been around for 34 years, started by Peggy O'Kane. I'm very privileged to lead our federal affairs team here at NCQA. I've been at NCQA approaching 9 years. Have had a variety of different roles working on our health plan accreditation program, but also really kind of the bread and butter of my work has been in government relations. And so we work closely with CMS, ONC, ASTP now, and SAMHSA, various other federal agencies as they implement quality programs, use quality measures, think about evolving the quality measure landscape to a more digital future. And so we work with them. They're really strong partners, and we really, on my team, look to cultivate those relationships.
Yeah, Eric, I have to ask this because you were recently on a podcast and basically said, I'm kind of paraphrasing a little bit, but basically said that TEFCA is about to have a breakout moment.
Yeah.
Obviously, you're in that camp of believing in TEFCA. Tell us a little bit more. Why did you make that statement?
Yeah, well, I think it's having a breakout moment because we're seeing both public and private industry come together and support. Just this week, Oracle said that they would sign up as a QHIN, a Qualified Health Information Network. They're joining Epic as a QHIN. And so we really feel that while there's a lot to figure out under TEFCA that make it work right, it's the right policy construct for America to make sure that we can get to nationwide interoperability. There's a lot of nuances to work through. I'm not trying to say that the job is done with TEFCA, but I think with industry support, with state and federal support, it's an umbrella for us all to get under to say, we can realize that next level of interoperability that we've seemed to struggle with since high tech in 2009. We put all this money forward, but we really haven't taken the gains both for patients or for providers or, the plans here in the room are, I think they're the next people to come to the table. And if we can get all, three of those plus our state and federal officials to see the value of TEFCA, it can go a long way.
Yeah, I mean, I think the world, meaning the world outside of healthcare, is kind of waiting, going, how come you guys can't figure out this whole interoperability thing? Every other industry seems to have figured this out. So yes, I mean, I think we're all hoping that whether it's TEFCA or something else or some other an acronym we come up with, that we somehow get this solved. But alongside that, Eric, I have to ask you this because I asked this question of Ed as well. It is 2024. We've been on the journey of value-based care and ACOs and all of this for a while now.
Right.
What's giving you hope that we're going to get there on that front? I mean, because interoperability is one thing, but interoperability is really an enabler for all this other stuff, moving away from fee-for-service to value-based care. What's giving you hope on that front?
Yeah, well, I think just in the last couple of days, CMS announced that once again, the Medicare Shared Savings Program and the ACOs in that program have saved taxpayers, I think it was $2.1 billion last year in 2023. So I do have faith and hope that we are making some progress, because I think if we don't, it's a fifth of our economy and it's going to bankrupt the country if we don't find a way forward. Am I at times concerned about how slow the progress has been? Yes, but I do think if you look at the kind of categories of value-based care, and the ones that are becoming more and more capitated, tying to quality, you are seeing 1 or 2 percentage points increase year over year of participation. It's not going to blow anyone's socks off, but it is a move in the right direction.
So Eric, what would you say to somebody who is maybe more of a pessimist,
Yeah.
who is looking at this going, guys, like we're 80% still fee for service.
Yeah.
And despite all these numbers that you just quoted and the
Yeah.
benefits, no one seems to be like running to value-based care.
Yeah.
What would you say to a pessimist like that?
I think it does go back to what's our alternative. The system today can't support a fee-for-service model indefinitely. While there will always be pockets and appropriately of fee-for-service, we need to move to a system that is more of a capitated model, and that is folks are getting paid for value. I have my own pessimism. I think that the models that we've tested to date at the federal level have showed some progress, but little. And so that evidence not being there keeps providers and others for fully leaning into the possibilities. And I'm really, I'm a believer of this digital transformation where if we can make it easier to take care of folks, manage chronic conditions, have new quality measures that really speak to value and in more real time, that we can find greater value in these relationships and folks will be more willing to join on.
Eric, because you work with government so closely, is there anything you can tell us about what may be coming down the pipe that as an industry we should be on lookout for?
Yeah, well, I do think there's a couple of efforts, one around exchange, so TEFCA, which we've already talked about, the national framework for data exchange, but I think also data standardization. So there's a lot happening at ASTP, requiring vendors, those that voluntarily go through their program, to standardize US CDI. So that's a data class element that you can find in every EMR or certified technology now. And that's evolving to have a plus. So US CDI plus. And so there's one for quality. There's going to be one for public health. There's one for maternal health. I think those efforts will help the industry come to a consensus on what the necessary data is that we need for whether it's quality measurement, prior auth, provider directory accuracy, all of those data points, if we can get them standardized, should help make the experience for whatever stakeholder, plan, provider, patient, more efficient and more valuable.
All right, so US CDI plus.
Yeah.
All right. What about the reverse, Eric? Are you bringing anything forward from industry, from NCQA members, from the people you talk to from the industry side that you're sort of championing in your conversations with the government entities that you deal with?
At any point, if there's a new emerging model in healthcare, I'm not a believer that it can just be the Wild West, right? So as we've seen other new modalities of care enter into American healthcare, virtual care, telehealth, we are doing a lot to talk to state and federal regulators about the opportunities to have high standards within the evolutions of those models. So we are seeing some interest from both the state and federal stakeholders in virtual care accreditation, which is a new program for NCQA and one that we're excited about and hope to see blossom more.
Let me ask you this, Eric, and it's a bit of a loaded question, but in your mind, because you've been doing this for a while, you deal with a lot of government and of course with industry, what's the right balance between the two forces, like the market forces of industry versus the policy making that happens in the halls of power? What's the right balance between those two?
Yeah, it really has to be a consensus-based process or it doesn't work. You'll get folks running to Congress and saying, CMS, you need to change your decision. I think the public comment process that happens with CMS and here at NCQA is a great way for people to get involved and talk about, what they hope these programs to look like. The balance of power, I think, TEFCA is a great example. It's a public-private partnership. ASTP and ONC are, sponsoring the initiative. They're bringing stakeholders from across industry to come together to say, hey, how do we solve this? And the more, whether that's interoperability or it's the next, whatever the next level of quality, the newest, emerging field of healthcare, those things will continue to happen.
Eric, as you look across the stuff that you're working on, the stuff that NCQA is working on, what's got you most excited?
Yeah, I think that there's a lot going on in standardizing data that's non-medical. And I think when you think about social determinants of health and the impacts on health equity and on patient care, that's 80% of a person's health outcomes often. And so there's a lot of initiatives both here at NCQA, but in the broader community to standardize that data, get that data into the healthcare environment so that people can actually address some of those issues. And while it's a big lift to ask of providers or for plans, I do think at the end of the day, when we look back 10 years from now, we will have closed a lot of those gaps and really help people out.
We're heading for a big decision next week, the election.
Yep.
So I have to ask you guys, I know, of course, that NCQA is a very bipartisan organization. And regardless of who wins, we're going to have a new administration in that office. What do you see coming down the pipe in the next sort of 12 to 18 months as we transition to this new administration? Is sort of business as usual, or do you think there's going to be some title changes here?
Yeah, well, I mean, in healthcare, I think the number one question is what happens with the Affordable Care Act. This last administration was very supportive. I think it grew by about 10 million new folks because of the subsidies. Those will expire at the end of 2025. The administrations are looking at those subsidies differently. So I think we could see, depending on the outcome and the policies that come out, some degrading of the exchange market. On the interoperability and digital side, I think it will be status quo. We've seen great support from both the Trump administration, the Obama administration, Biden administration on investing in interoperability, keeping the ball rolling, even though there has been administration changes. So as far as investments into digital, I think they're still strong investments. And I think that the government will continue to support and put money behind those.
Yeah, the standards are the standards. They're not, those standards themselves aren't partisan. They're not political, right?
Right.
As you look across the industry, you mentioned it just briefly there, like how can people listening to this and watching this who are either at a vendor or at a provider, how can they get involved?
Yeah.
What's the best way that they can help shape some of these things that are happening at the macro level of the industry?
Yeah, well, there's a lot of consensus-based groups that are supporting this full evolution to digital healthcare. And I would say they all go through public comment processes. They all have conferences. We're here at NCQA's conference. We're here to talk to folks. We really want to know what's working and what's not working. And so I would just say, be engaged. Don't check out and kind of put your hands up and say, I can't do anything, because that's not true. My first couple of years at NCQA was on the accreditation side of the world, and we would read every single public comment that came in and take it to heart, right? And what is the stakeholder saying? Do we need to call them up and understand more? And, I think that there are public policymakers, there's folks here at NCQA who do want that feedback. And so send us your letters, emails. You have to be active. You can't be a passive participant.
Well, Eric, we are here at the Innovation Summit by NCQA, a great event. What are you hoping people will leave this event either feeling or with new knowledge around?
Yeah. Well, you talked about pessimism earlier. I think that this conference should break down some of that, because there will be hands-on learning where you can take things back to your own organization and put it into play. And that's what we want the Health Innovation Summit to be, that sharing of ideas, sharing and making connections. And that's really what I think it has been over the last few years. And we're really excited to have a great conference.
Well, Eric, you've shared a lot of great information with us. Where can people go to learn more about NCQA?
www.ncqa.org, or feel free to reach out to any of us on LinkedIn.
Amazing. Yeah. Well, Eric, thank you so much for being on the program. Really appreciate your time.
It's great being here. Thanks so much.
Hey, I want to thank Eric for taking time to join me on camera to talk about policymaking and the march to value-based care. I'm encouraged that people like Eric and the team here at NCQA are trying to bring an informed and balanced approach to moving the industry to a better place, also known as VBC. I also want to give special kudos to Eric for being willing to answer my election-based question. And if you enjoyed this interview, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung for Healthcare IT Today here in Nashville, Tennessee for the NCQA Health Innovation Summit. Thanks for being here, and I'll catch you on the next episode.